All right. Hello, guys. Good morning, Vibrant Life family. We are going to talk today about obesity. We're going to talk about irritability and our kids. We're going to talk about ADHD and things in general about how sleep could actually be having a profound impact on your child's health. So in just a second here, we are joined today by our guest, Dr. Carla Damon. And we're going to discuss, again, sleep disorder breathing and how it can play a role in all of these different kinds of symptoms and with your child's health. I'm Dr. Max, your Dallas kid Chiro. And like I said, we're about to be joined by Carla. She is a board certified pediatric dentist that is geared towards prevention and wellness. She has done extensive training and studying in oral dysfunctions, restrictions in the mouth that can lead to feeding and speech difficulty. Okay, so without further ado, hey, Carla, can you hear me?
Yes. How are you, Dr. Max?
Doing great. How are you doing today?
Good. I'm doing well. Thank you.
Awesome. I'm super excited to dig into this topic today because I think it's something a lot of parents haven't necessarily heard of, and I know it's huge as far as health is concerned. But before we really dive deep into the topic at hand, I always like to ask our guest, a little bit more about themselves. So specifically, tell us, why did you decide to be a dentist and a pediatric dentist at that, right?
Yeah, I come from a family where a lot of us are in the healthcare field. So I knew I wanted to do healthcare, but then I also knew I wanted to be a mom and own a business. So put those together, and dentistry had always kind of been in the back of my mind. When I got to dental school, I then just honestly felt called to do pediatric dentistry. I loved my pediatric dentist. I had a mouthful of fillings growing up. And so I had a really good experience growing up, going to the dentist. And I just wanted to share that with other people and be that person for families. But, as I went down this path, I kind of realized I don't want my kids or other kids to be the kid I was, right? Mm-hmm. With all these, with fillings and oral dysfunctions and things like that. So that's kind of what took me on the next path and the next step in my career, which we can talk more about today.
Yeah, for sure. So it was, so that makes sense. It was more of like a personal history with you, something that you actually went through, which interestingly enough is like every person we've talked to so far, especially when you start getting more towards like, holistic care or alternative care in some sort of way, it's almost always a personal story about their children or themselves, right? That kind of got you here. So what does it mean to be a dentist that works in prevention and wellness? I think whenever people hear like wellness and dentistry, they instantly think, oh, like, you're going to stop me from getting cavities. But there's actually a lot more to it than that, right?
Totally. So, you and I have had this conversation. Most people just think the dentist looks at that 2-inch box, your mouth. But really for me, I don't want to be the person that band-aids problems. I want to get to the root cause. So for me, that's where the wellness and prevention comes into play. If the kids are having high rates of decay, there's obviously some acid problem going on, possibly some bacterial issue going on, and we are connected head to toe. So we've got to look at the whole picture, the whole body, and not just the teeth. We got to look at the kid, the family involved, everything. And so that's kind of why I'm more prevention and wellness based. I really want to dive into the root cause of things, and not just fill cavities all day.
Yeah, definitely. It's something that you'd mentioned before. And I know that's like a common thread of a passion we share, is really getting to the root cause of what is actually going on and not really covering stuff up. How did you develop your approach to your practice, and what do you do that's a little bit different?
So my practice will be prevention and wellness based, right? So every kid will get screened with a sleep questionnaire, because what we're finding out today is a lot of kids that aren't sleeping well, you're usually diagnosed with ADHD. They go hand in hand. I'm not saying it's 100% of the time it's not 100% of the time something I can fix, but a lot of times it is related to poor growth and development on the kids' part. Their jaws aren't developing due to epigenetic causes and environmental factors. And so we screen every kid in our practice for that. And then we have a learning lab in our office. And so every kid is going to learn how to brush and floss their teeth. If you think about it, most of the time when we go to the dentist, we're not taught these things, right? We just hop up in the chair, we get our teeth brushed, and then move on, with our day. But we're actually going to really teach kids and give them responsibility to take care of their own health. And then they get to do a fun science experiment related to dentistry. They get to learn about the foods they're putting in their body, sugar, oils, processed foods, and how that can really impact their growth and development and their health.
That's awesome. And I know you used like a slight word. I don't know if everyone caught it there, but epigenetics. Hopefully, if you're someone who's followed me for a little while, you've heard that term before. If not, I highly suggest everyone look it up. It's really important because it's essentially getting to this concept and the scientific fact that we have a huge role and an effect on our genes, that we're not dictated by them, right? We're not stuck to them, which obviously goes along with the prevention. It's that you can take control of your health. It's not just happenstance, right?
Yeah.
So it's awesome. And that makes sense. Yeah, you educate. I love it. Today, we're going to discuss pretty specifically sleep disorder breathing and what is involved with that. Because obviously, we named a lot of symptoms earlier: obesity, irritability, learning development, bedwetting. I mean, I think there's a lot, right? So I definitely want to turn it over to you on that aspect. Can you tell us what exactly is sleep disorder breathing?
So it is kind of what it sounds like, sleep disordered breathing. So you're having some sort of interruption of breathing while you sleep. So imagine if you cannot get the proper oxygen while you're sleeping. Do you think you're going to get a good night's sleep? Probably not. So what that translates to is these kids are just not getting into deep sleep while they're sleeping, so their bodies don't repair. Then they wake up tired, they have dark circles under their eyes, they don't perform well in school, they have aggression, behavioral issues. The best way for me to equate that to a parent is we all have had 2-year-olds, and when they don't take their daily nap, they are a terror. At 5 o'clock, you are done. So translate that to a 5-year-old who has not slept well for multiple nights for probably their whole life. And then think about how they're going to act in school. They're constantly going to be moving. They're going to be in sympathetic overdrive. They're going to have adrenaline all the time. They're going to be touching things, moving things, opening drawers, talking, interrupting, all those things. And so mom gets concerned, the school's concerned. What do? They go to the doctor, and then they possibly are going to go down the path of getting put on ADHD meds.
Right.
Well, there was a study that came out, and they compared kids that hadn't slept well with kids that had diagnosed ADHD, and you put them in a room together, and nobody could tell who was who. So both kids acted the same. So is it a sleep issue, or is it truly ADHD? And so I feel like going on meds is really a Band-Aid to the problem. Why not get to the root cause?
Yeah. I mean, that's actually really fascinating. And I think a lot of people, don't think about that. I mean, Doc, I know that, in our practice here, we see a lot of kids. I see a lot of kids with neurodevelopment issues, with ADHD, like hyperactivity, sensory processing, all these different kinds of things. And, all of them are on the rise. Specifically, ADHD is up on the rise too. And I know, from what we do, our perspective here is we help to reduce that sympathetic overdrive you were talking about. So we hit the brakes, get them off the gas, and we help calm down their nervous system and their brain. And that's just one of the many pieces of the health puzzle, right? Along with like what you do and what you can help people with. But my point here is that's on the rise. And do you think that sleep disordered breathing is the reason for that, or maybe one of the reasons that could be?
I definitely think it's a piece of the puzzle. Have we talked about Pottinger's cats?
I don't think so.
Okay. I highly recommend it for everybody to read. It's basically goes into, I'll just give you a brief summary. This guy, this scientist in the 1950s, had 2 subsets of cats, right? There was the healthy cats. He fed each generation raw dairy and raw meat. And every generation of cats was healthy. Okay, then he had this group over here. He fed them, more processed milk, processed foods. And so each generation had smaller jaws, crowded teeth, bone changes, adrenal changes, thyroid changes, and until the fourth generation didn't make it. And then when he took a subset and moved them over to the healthy group and started feeding them the raw foods, it took 2 generations to heal.
Mm-hmm.
So are we in that? Possibly. And, our food sources are getting poorer. Processed foods are on the rise. And so I do think our environment plays a huge role in why our jaws are possibly getting smaller. When you go back 400 years and you look at jaws of hunters and gatherers, they had all 32 teeth. They weren't getting wisdom teeth taken out and extractions for braces and crowding. They didn't have those things. So we have to think, well, why?
Right.
We're not doing hard foods. We're doing soft pureed foods and things like that. And so my goal is to get my kids in my practice back to where they don't have to do braces. I'm going to try to prevent it at such an early age that they're not going to have to get braces. Now, is that realistic? I don't know, but that's a goal for us.
Yeah, for sure. That's really good, right? I mean, and that's what science is all about, is asking questions and really trying to get to the root cause of what's going on. So you talked a little bit about what sleep disorder breathing is. How does it begin with? How does it occur?
Yeah. Some of the people I communicate with believe it actually can start in utero with mom. So if mom has a lack of oxygen while she's trying to sleep and grow this human being, is it affecting the baby? Possibly. But when you start to see a kid mouth breathe, that's kind of that's a beginning sign that something's going on. And usually kids that mouth breathe are those people that are in their 60s, 70s that have full-blown obstructive sleep apnea. So sleep disorder breathing is an umbrella term. It can include mouth breathing. It could include snoring. It can include obstructive sleep apnea.
Okay.
So we use this umbrella term to describe what it is. But kids that have large tonsils, large adenoids, deviated septums, tongue ties, or they're just growing, their jaws are growing small, are usually the kids that are going to start obstructing while they sleep. And when I mean obstructing, I mean their oxygen's getting blocked. So what they do is when their oxygen starts to get blocked, they arouse during the night and wake up. They don't necessarily fully wake up, but they might get an arousal or a sympathetic discharge so that they're constantly in fight or flight all night long.
Yeah, they're not calming down ever. No. Right. That makes sense. They can never actually go all the way to that break and that parasympathetic side. Okay. Yeah. So, well, I think you kind of answered that too. My next question was going to be more along the lines of things that you can look for, but I think we got mouth breathing, right? That's going to be a big one.
Yeah.
Are there any like structural features or anything else to look
for? Totally. Because I'll get parents call me or friends will call me and they'll ask me all these questions like, what do I look for? And people don't really think, they think it's cute and it looks good, but when your kid's teeth are all touching and they're baby teeth, that's a bad sign. If your kid starts to show a really gummy smile, that's a bad sign. If your kid has a retruded jaw, that's a bad sign.
Okay.
Or, the whites under your eyes, the sclera, if they start to show those, that's a bad sign. Or if they have dark circles under their eyes, that also shows that they're just not draining properly. They're probably narrow in their maxilla.
Okay. That makes sense. Those are all things to look for. And they're either kind of, like you said, it's an umbrella term. So I guess it's showing different areas, like maybe a lack of oxygen, right, getting to their body, or just something obstructing it in general. I want to mention something. I don't know if, I apologize, I don't know if I read it or if you actually told it to me earlier, but I was looking at mouth breathing, and I read that there are changes in the actual environment of your bacteria that can be caused from mouth breathing. Can you elaborate on that?
Yeah. So anytime I get a kid that has a ton of dental decay, we need to get to the root cause. So is it diet? Are they drinking lots of sweet things, snacking constantly? Do they have a low pH in their mouth? Or are they mouth breathing? So mouth breathing changes the bacteria. You should use your nose to breathe and your mouth to eat. And
That
I
makes,
say that
yeah,
when people
that makes
laugh at
sense.
me, but your mouth is a backup organ for breathing when you get stuffy or you have a cold. And so your mouth really, you shouldn't be, it does change the bacteria in your mouth. It dries out your mouth. So then you're more susceptible to the dental decay and things like that. And what's really crazy is we compartmentalize things. So we just think usually, okay, our mouth is different than our gut. Well, but you're swallowing all day long, right? So if you have bad bacteria in your mouth, we all have bacteria, okay?
Yeah.
But if you have the bacteria that causes the periodontal disease or the cavities, and you're swallowing all that, you're seeding your gut bacteria with this bad bacteria. And so we tend to compartmentalize. We don't think we're tied, we're head to toe. It's all going to be affecting, each place. So
Yeah. Yeah, definitely. Are there, that's a really good point, actually. I mean, for sure, every single system is actually tied together, right?
Mhm.
You can't just affect one part without affecting all of it. I wanted to ask too. So let's say that one of the audience members out there, they have a child and they see some of these early signs.
Yeah.
Is there anything that they can do, like immediately, to help in that area at all?
Yeah. So really, I always say videotape your kid while they sleep. If you suspect anything, videotape them.
Yeah.
And then there's a book I highly recommend. It's called Sleep Wrecked Kids. You can get it on Amazon. I give that out all the time because I feel like once a parent reads that, then they really realize, my kid really isn't sleeping good. They get up to go to the bathroom at 2 a.m. every night, and that's a sign that they're not getting in deep sleep. Or they wet the bed, they're not getting in deep sleep.
Okay.
Then, check for mouth breathing. Does your kid sleep with their mouth open, or do they mouth breathe during the day? And then start nasal clearing. And when I mean nasal clearing, it's essentially nasal hygiene. Start blowing their nose. You can use like a nasal spray, like Clear or the saline spray, and try to help them breathe through their nose, because that's kind of step one in every treatment plan I give, is just to start nose breathing, closing your mouth. And then I would say find a dentist that can help kind of diagnose if there's some sort of malocclusion associated with your sleep issues. I
Right.
can't treat sleep. I'm not a sleep physician, right?
Mhm.
But I can collaborate with others and get parents where they need to be.
Yeah.
So that's kind of the other thing I wanted to talk about was I am not the one-stop shop.
Mhm.
You and I, we collaborate, and we collaborate with tons of other people in the area, whether it's an ENT or a sleep physician or a nutritionist or an allergist. We are all collaborating to get these kids back on track.
Yeah, absolutely. That's fantastic. Thanks for that. It's always good to give people action steps for things that they can look for, I think, before, right?
Yeah.
To help them kind of narrow it down instead of just randomly going to specialists and try to figure things out. And that actually goes along with your other point, is being able to kind of work with other professionals. Like we've stated before, we do very different things. But a lot of times, we're just a piece of that health puzzle, like I like to say. And there are a lot of different pieces. For some people, they might come to my office and I am the missing piece they really needed, and it just huge results. And the same for you.
Yeah.
But often whenever we work together, the benefits are just exponentially more, because just like health, it's holistic, right? Like you said before, we can't separate systems, and it's the same way.
Yeah.
We have to work together. Absolutely. That's a great point. I guess we talked a little bit about things that someone could do if they suspect it. Are there things that people should just absolutely not do, like avoid, because it can be detrimental?
I don't want to say, not necessarily. I think you really need to find a specialist that can guide you and help you. Like some people in my field say, your child should not suck their thumb, or they should not be on a pacifier. But I feel like there's a time and place for those things. And will they cause some things that may cause greater problems in the future? Possibly. But they do serve a purpose at the time, for whether it's to soothe the kid, or some people believe sucking their thumb can kind of help pull their top jaw forward. And it's a way for a kid to breathe better. So do you really want to take that away from them?
Yeah.
So I really can't think of anything not to do. I would just say find a specialist that can guide you and can help you find your team.
Awesome. That's really good advice. Did you have any particular stories of patients that you might have worked with that were struggling and kind of you found out that's what it was going on, sleep disorder breathing, and you were able to overcome it, get good results from it?
Yes. So I have a 7-year-old patient right now. It's multidisciplinary because there's some socio type stuff going on, like with a divorce in the family, but she nobody suspected anything, but when I looked at her teeth, I could tell there was something deeper going on, right? So I did my 3D scan of her face, and I did an at-home sleep screening test, which came back and said severe sleep disorder breathing. And then when I sent her x-ray to the radiologist, same thing. And, most people after getting that report would say, hey, I'm going to send you to the ENT. They said your adenoids were class 3, you need to get them out. Well, what we're doing is we're expanding her top jaw to increase her nasal breathing. So every millimeter we expand her maxilla, she gets 2.4% more airflow in. So a lot of these kids are 10 millimeters deficient. So if I expand them, I'm going to get 24% more airflow. And then we're going to bring this whole part of her face a little bit more forward, open up her airway, and she won't have to get her adenoids removed. And then we start the nasal hygiene program, which then causes her to shrink those tissues, and she can breathe better through her nose. So it's lots of steps involved. And it's a process. It's not a one little quick fix. It takes a team and a process to get there.
Yeah, it's not a quick fix. I like how you say that because, the reality is what we know, that real health is often not a quick fix, right?
Yep.
It takes a lot of working at it. But that's really cool. And I think definitely an interesting topic because I don't think many people are very aware of that subject. And just obstructions that might be prohibiting oxygen flow. Obviously, we all know our body needs oxygen, but when you start thinking about all the different areas that it can affect and impact, right? Like we said before, it can, cognitively, it can affect learning development. It can affect the amount of sleep they're getting, the quality of sleep. There's a huge thing when you talk about getting people over on that gas pedal and on that sympathetic nervous system, and they're driving that. That's just a whole slew of issues that can result. Even all the way into being maybe diagnosed with neurodevelopment issues, perhaps correctly or incorrectly, really, just due to that. Fascinating stuff.
The one thing I forgot to mention about that case was, this goes also back to like her socio type stuff. She does suffer from depression. And so is that a piece of the puzzle? Possibly. If we get her sleeping right, maybe that would get better, and decrease anxiety as well. Yeah,
absolutely. So again, just kind of to recap, there are some, things to look for in your child, especially if you're having some symptoms like that. You want to make sure and see if you can kind of, I believe you said suggested to videotape your kid sleeping.
Yes. Videotape your kid sleeping. Check for things like, are they going to the bathroom? Are they waking up? Are they sitting in their sleep, tossing, turning, grinding, snoring, sleep talking, sleepwalking, all of those. There's something deeper going on. Okay.
Yeah. So that's awesome because it gives people action steps. That's something you can look out for. If you suspect that might be the issue, you definitely want to contact, if you're in the DFW area.
Yes.
Contact Dr. Carla Damon. So I'm going to link her contact information, so it'll actually be in the title as well as a comment if anyone wants to reach out to her website. Was there anything that you're possibly in the works on right now that you might want to share with anyone out there? Any projects?
Yeah. This whole COVID situation's been so interesting, but it's kind of given everybody a chance to think and really kind of team together. So I have been asked to be a part of a group that's actually going to start writing policies and protocols and present it to the American Dental Association in September to kind of get the word out there and to start treating these kids, because they're thinking 9 out of 10 kids have sleep disordered breathing.
Mm-hmm. Yeah.
So 90% of our kids have it, but nobody's really screening for it or talking about it. So our goal is to go write simple policies, have webinars, videos to train other dentists. So yeah, that when I got asked to do that, I mean, I was jumping up and down.
Yeah.
I couldn't turn that one down. So,
that's so awesome.
Yeah.
That's fantastic. Well, I definitely want to hear more about that, and we'll keep in touch going forward with that for sure. Let's see here. I don't think there were any questions. So again, I'm going to link your description up in there. And thanks for joining us. It's always a pleasure to get a chance to speak with you.
Yeah, thank you so much for having me. I really appreciate it.
All right. Well, we will catch you later. Okay, Doc?
Thank you. Take care.
Yep. So that's it for today, guys. Again, I'm Dr. Max, your Dallas Kid Chiro, and we were just speaking with Dr. Carla Damon, pediatric dentist. If you know anyone at all that can benefit from this information that we shared today, please share the love, let people know. If you have any questions for Dr. Carla, again, I'm going to put her contact information in here. Anything from sleep disordered breathing to dentistry in general. Shoot your questions over to her. If you have any questions about neurofoundational chiropractic, about pediatric chiropractic, how that works, feel free to direct message, email, send anything to me if you need to. And until next time, guys, stay happy and stay healthy.